I'll welcome everyone on behalf of Father and all the admin panel for this discussion this evening. We are dealing with week fifth, day 4, part B reading.
Good evening, all. I am one of the OET aspirants from Edu Skills. I would like to say thanks to Father and admin member for giving the opportunity. Today, I am going to discuss about reading part B introduction and question first and second. Here, question: when disclosing distressing information to patients, staff must avoid. Here, hedging word is disclosing distressing information and staff avoid. In this, they are going to tell staff should avoid something. We have to see for that answer. Now we can see the answer option. The temptation to use here simplistic language. Here, the hedging word is simplistic language. Then option B, directing their attention at family members. Here, hedging word is attention at family members. Option C, any approach which leads to misunderstanding. Here, hedging word is which leads to misunderstanding. Now we can see the paragraph. They extract from a manual on surgery disclosure. The delivery of bad news is very difficult. Arrange to talk to the patient in the company of family, preferably away from the other patients. In some cultures, it is not common to give difficult news directly to the patient. We must be aware that the norms and customs of our patients may not match our own. Often, we try to soften the delivery of bad news by saying too much and confusing the matter, or by saying too little and leaving people with unanswered questions. Don't say neoplasm if what you mean and what will be understood is cancer. Be clear, allow people to understand and feel some of the impact of the news, and then allow them to ask questions. It is often necessary to repeat the information to other family members or to the same people the next day. Here, now we can see we are seeing the nature of the text is manual. Here, talking about the disclosure of the distressing information to the patient. In their topic sentence, they're telling delivery of bad news is very difficult. So, what are the things we have to do and what we should not do? Like that only they are explaining in the paragraph. Here, first they are telling this is very difficult to convey the bad news. Then, so what we have to do? Arrange to talk to the patient in the company of family, preferably away from the other patient. First, we have to do. We have to company of with the patient's family and away from the other patient. Then second one, in some culture, in some means that is a scale expression. It is not common. This is a negative expression. It is not common to give difficult news directly to the patient. We should not give difficult news to the directly. We should not tell to the patient. Then next they are telling we must be aware that the norms and customs of our patient. They are telling we should aware of the patient's norms and customs because that may not match our own. The because our customs and patient custom is different, so we should be aware of the patient's norms and customs. Then often is a time expression. Here our answer is paraphrased here. We try to soften the delivery of bad news by saying too much. Here also too much is scale expression and confusing the matter, or or by saying too little also scale expression and leaving people with unanswered question. Here they are telling if we say too much means they will confuse the message. Then if you say too little means they will not understand what we are going to say. They will not understand. So then again they are giving another instruction. Don't say neoplasm. We should not use the medical term. If what you want, if what you mean and what will be understood, how the patient will understood, like that we have to tell. Is cancer, like that we have to tell. Then again they are telling be clear. We should be clear. Then we have to allow the patient to understand what we are going to say. The patient should understand and feel some of the impact of the news, and then allow them to ask question. Then we have to give the space to ask the question to clarify their doubts. Then it is often necessary to repeat the information to other family members or to the same people the next day. We have maybe we have to repeat the same information to the other family members. One day we will speak with one family member, maybe the same day or next day also we have to explain the same thing to the other family member. Now we can see the answer option. The temptation to use simplistic language. Here, if they are telling what staff should do, means we can tell that the option is right. Use simplistic language. But in the question option, they are giving, they ask staff must avoid. What the staff should avoid? We should not avoid the simplistic language. We should use the simplistic language. So answer option A is wrong. Then option B, directing the attention at family members. Is it we have to avoid the patient family members? No. In the last line, they mention it is often necessary to repeat the information to the family members. But the answer option opposite only. We must avoid attention at family members. So the option B also wrong. Then option C, any approach which leads to misunderstanding. This is a correct answer. The staff must avoid any approach which leads to misunderstanding. That is paraphrased in the green one. Often we try to soften the delivery of bad news by saying too much and confusing the matter. If you tell too much means they will confused, and if you tell little means they will not understand. That is the paraphrased one, that which leads to misunderstanding. If you say little means they will misunderstand, and they give the second one, be clear, allow people to understand. So we have to make them to understand. So answer option C is correct. Next question. The purpose of the guidelines for general practitioner is. Here the hedging word is purpose. The nature of the text is guidelines. Here they are asking what they are going to tell for general practitioner. The option A, to remind them to write asthma action plan. Here hedging word remind to write. The asthma action plan is common for three options. Then option B, to raise their awareness of the value of asthma action plan. Options here, hedging word is raise awareness of the value. Option C, to direct the discussion with patient about asthma action plan. Here hedging word is direct discussion with patient. Now we can see the text. Heading is policy guidelines for general practitioners, asthma action plan. An integral part of asthma management is the development of a written asthma action plan by the person with, with asthma and or their carer together with their doctor. An asthma action plan helps the person with asthma and or their carer recognize worsening asthma and gives clear instruction on what to do in response. The process of developing a written asthma action plan is important, as this should be a discussion of the person's individual asthma and its management. The written plan is a reminder of the discussion. Written asthma action plans are one of the most effective asthma interventions available and have been shown to reduce hospital admission and emergency visit to general practice. Now we can see the text. In the topic sentence, it's telling an integral part of asthma management is the development of a written asthma action plans. Here they are giving the integral part means that's important part for the asthma management. What is important means asthma action plan by the person with the asthma and their carer together with their doctor. This plan who have to return means the person with asthma, means that means patient or their carer together with their patient. Now they are telling the importance and who have to return the asthma plan. Then supporting sentence telling an asthma action plan helps the person with asthma and their carer recognize worsening asthma and gives clear instruction on what to do in response. First, they gave asthma action plan is important and who have to write. Then second, supporting sentence is explaining the useful how the asthma action plan is how the asthma action plan is helping. It will help the patient and carer to recognize the symptoms, how the worsening symptoms, how the symptoms is coming, if the symptoms come means what they have to do in the response. Like that, it is useful for that. Then the process of developing a written asthma action plan is important. Now they are telling about the process of the action asthma action plan is important and it should be discussion of the patient's person's individual asthma and its management. How we have to do with persons with asthma. They have to discuss with that like that they have to do the process. Then the written plan is the remainder of the discussion. Then written asthma action plan are one of the most effective intervention for asthma. Then again they are telling the asthma action plan is very important intervention for the asthma because the result they are telling if they use the asthma action plans what will they gave got the result means to reduce hospital admission and emergency visit to the general practice. Now we can here the asthma action plan is a keyword. We already saw one type of the question means keyword based questions. This question also same like that. The asthma action plan is so many times repeated in the paragraph and it is explained the that keyword only. Now we can see the option A to remind them to write asthma action plan. Here they are asking about question purpose of the guidelines for general practitioner. But here they are trying to remind them to write asthma action plan. So it is wrong. We already saw in the topic sentence, this action plan have to write by the patient or their carer only. The general practitioner no need to write the asthma action plan. So option A is wrong. Then second question is to raise the awareness of the value of the asthma action plan. This is the correct answer because in the topic full of the topic they are telling about the importance of the asthma action plan, how it will help the patient. They can identify the recognize the worsening symptom. It will reduce the hospital admission. So they are telling fully. They are telling about the value of the asthma action plan. So answer B is the correct answer. Option C to direct the discussion with patient about asthma action plans. Here they are asking the purpose of the guidelines, but this is telling about the process. The process of developing a written asthma plan only is the discussion with the patient. So option C is wrong. Thank you.
And now it's time for me to explain question number 3 and 4. So question number 3 says that the guidelines on chemical waste disposal stress the need for the staff. So let us see what are the keywords here. Guidelines and chemical waste disposal. This topic will be talking about chemical waste disposal. Okay. And the stress is the need for the staff to do what. So we have to read with the answer options to match the answer. Okay. Here keywords are guidelines, chemical waste disposal, and stress the need for the staff to do what. Okay. So the first answer option says take appropriate safety precautions when handling chemical. So what is the keyword here? Appropriate safety precautions. And so they are asking about the chemical waste disposal here and what the staff has to do. So the first answer option says take appropriate safety precautions when handling chemicals. So this is talking about the safety precautions. So this is the keyword is main keyword is precaution. Okay?
Precaution.
So second option says ensure that any chemicals in the hospital are properly documented.
Okay.
So here you can take ensure also as a main. What is a synonym usually they use for ensure?
Yeah.
Yeah,
Must.
must and ensure is same. Okay, that any chemicals in the hospital are properly documented. So we can take documentation as a main keyword here. Then C option says consult service providers before disposing of all the hazardous chemicals. So here you have to consult a service provider. So the main keyword is consult, and you can see here there is all. So all is an, what is all?
Absolute.
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 Yeah. So
Natural.
naturally, according to our father Celine, we can eliminate this, but still let us see what the paragraph is talking about. So it says unknown and empty chemical waste container. So the whole paragraph is speaking about what? Chemical waste disposal. So let us see the paragraph. Unlabeled chemicals are increasingly difficult and very costly to dispose of. Any require special analysis in order to identify them. If you can see here, uh, there is a synonym word in the first letter itself. What is it? Unlabeled. Can you tell me what is a synonym in the answer option anywhere? What is the meaning of unlabeled? If you see the main keywords which are underlined, which goes with unlabeled? Is it precaution,
Documented.
document? Yeah.
Okay.
So unlabeled means not
Okay.
properly documented. So that is, you can underline there. Okay. Whenever you read like this. Okay. Furthermore, the hospital chemical waste contractor will now not remove any unknown chemicals due to their risk level. So this and all is not important for us. So we can usually just glance through it and we can eliminate that line itself. Okay. Every effort should therefore. What is therefore? Therefore is uh, adverb conjunction, conjunctive adverb. Okay. So this word is very important. Be made to ensure. We can see there is ensure here. It matches with which answer option? Ensure.
B.
Yeah, B. So
Option
we
B.
can underline that, and we know that the answer should be somewhere here. Okay. That all chemicals in use in storage or being prepared for disposal are fully labeled and described. So what does it mean? Fully labeled and described means what? Documented
Properly
properly.
documented.
Yeah, so we already got the answer here by knowing the synonym or synonymous language. So there are so many words which matches with our keyword, isn't it? So after ensure, there is the answer. So all chemicals in use in storage or being prepared and disposal are fully labeled and described. In order to kill the enemy, what is the enemy? Time, isn't it? So we got the answer already. We need to read other things, but still we can go keep a glance on it. Okay. If unidentified waste is discovered, you should immediately notify the hospital designed waste contractor and not the service provider. In C, they are telling service providers. So we can naturally, we already eliminated, but still it doesn't match with the paragraph. It is exactly the opposite they are saying. So we can eliminate answer C. Okay, we hospital desk can complete an incident form. Incident form is also a type of, what is it? Documentation, isn't it? All empty containers which have previously contained chemicals for licensed disposal must be considered as hazardous waste until cleared. So we are clear here that the answer is B through uh, underlined words. You can see there are many words which are matching with our documentation. So our answer is answer B. Ensure that any chemicals in the hospital are properly documented. So if you go according to the nursing knowledge also, our main aim is documentation as a nurse. So if there is an answer there regarding documentation, that is very most of the time will be important. Okay. Here the main context of the test is waste disposal, and concept here is documentation. I hope I'm clear. So let us go to the next question, that is memo. So let us go to the question. So what does question number 4 says? Let's see. The memo is reminding pharmacist about. So what are the main keyword? Memo. And who is what is they reminding about? About. It's an about question. Okay. So reminding pharmacist. So this is about question and it's a memo. To whom? To the pharmacist. So let us see the first answer option. The rationale for conducting incidents and errors, documenting incidents and errors. The B option says in this the main keywords are rationale for documenting. So here also it is talking about documentation. About what? Incidents and errors. And B, the procedure for investigating incidents and errors. And C says the method for submitting incident and errors. So the concept based keywords, let's see here. First, concept based are rationale, procedure, and method are concept based keywords. Whereas documenting, investigating, and submitting are the differentiating based keywords. So here also you can see they are talking about documentation. Let us read the paragraph now. The memo, all stuff to all stuff regarding what? Pharmacy incidents and errors. So this is going to talk about pharmacy incidents and errors. So dispensing errors, other significant errors, omissions, incidents. So in the bracket we can eliminate, because what is it? See all this other significant errors, omissions, other
Subject complement.
yeah. So directly you can eliminate so that we can save our time. We can read from here. So pharmacist. So this goes with our keyword pharmacist. So should therefore follow a risk management procedure. So what is the procedure they are explaining here? Including appropriate record keeping, which matches with this keyword synonym. Record keeping. Record keeping means what?
Document.
Documenting.
Document.
So
Documenting.
this goes with, yeah. So again they're insisting on documenting. Again, see there the record is to show when the incident was recorded, when it occurred, who was involved. This is all what the result, isn't it? So these are the result. So this also is directly pointing us to option A. The nature of the incident or complement, what actions were taken, and any conclusions. This is the result. Okay. So there their cause and effect, they are talking about cause and effect language here again. If contact was made with third parties such as government departments, prescribers, lawyers, or professional indemnity insurance companies, details of the conversation should be recorded. Should be recorded, again the synonym of document. Okay. Regardless of how serious the incidents may appear, comprehensive detailed records need to be kept. So again they're talking about documentation. So the whole paragraph is only pointing us towards the option A. So rest to, what is that? Procedure of investigating, they're not talking at all. And the method of for submitting incident and error report, where is it? The record should be kept, they're telling, but not nothing regarding the submission. So one of the keyword was submitting. There is nothing regarding submission. So the record should be kept for 3 years before, because of the delayed nature of some form of legislation. So this whole thing is talking about documentation. So our answer is option A. You can see differentiating based keywords and concept based keywords. On the left is the on the right is the concept based, and on the left, like documenting, investigation, submitting, are the differentiating based keywords. The type of text is memo and the context is incidents and errors. And if you can see the last slide, the whole thing is talking about the record, keeping records. So our answer is option A.
I'm Rinjini, one of the OET aspirants from EduSkills International. Today, I will take the question number 5 and 6. The question number 5. What point is being made in this guideline about patient with the multi-trauma? This is a guideline and the keyword is the guideline and the patients with the multi-trauma. The option A, staff should make it a priority to rule out the spinal injuries. The keyword is the rule out. And the option B, spinal injuries are missed in a small but growing number of cases. The keyword is growing number of cases. Option C, there is evidence that immobilizing a patient with the spinal injury is helpful. The keyword is immobilizing. And the text heading, evaluation of potential spinal injuries. So the keyword is the evaluation. So option A, the synonym of the evaluation is mentioned. The rule out is the synonym of evaluation. So the paragraph, among adult patients suffering high energy multi-trauma, approximately 5% will suffering a significant, there are mechanically unstable vertebral column injury and significantly less than 1% suffer a spinal cord injury. The main risk from undiagnosed unstable vertebral column injury is that further neurological compromise will occur. Balanced against this rare but potentially catastrophic risk is that the majority of trauma patients do not have an vertebral column injury, and the prolonged application of spinal precautions or immobilization is associated with multiple complications, including pressure sore, raised intracranial pressure, or ventilator-associated pneumonia. So furthermore, the efficiency of these interventions in reducing secondary neurological compromise is controversial. Therefore, patients in ICU should undergo spinal evaluation by CT image and interpretation by a consultant radiologist within 24 hours of injury. If image is undertaken out of hours, it is acceptable to continue spinal precautions overnight and review imaging early in the next day. This is a conclusion-based question. So we have moved to the second option. The second option is the spinal injuries are missed in a small but growing number of cases. The topic sentence says that amongst the adult patients suffering high energy multi-trauma, approximately 5% will suffer a significant and less than 1% suffering a spinal cord injury. So in our further strategy, whether we can see a number or percentage in the text, immediately go through the particular sentence. So in this paragraph, says less than 1% is suffer a spinal cord injury. The less than is a scale expression. The second option, growing a number of cases. Growing is a scale expression. Both the scale expressions are different. So the B option is easily eliminated. And the option number C, there is a evidence that immobilizing a patient with a spinal injury is helpful. Fifth sentence says, prolonged application
That immobilization is associated with multiple complications.
Okay, the paragraph says, the immobilization leads to some other complications like a pressure source and raised intracranial pressure. So the answer option is saying immobilization is helpful for the spinal cord injury patients. So the both options, the paragraph and the options are saying not correct. So the C option is eliminated, and our correct answer is an answer option A. Staff should make it a priority to rule out the spinal injuries. This is a conclusion-based question. So the last sentence, Therefore, it's a contrast word we can see. In our father's strategy, after a contrast word, we can find out the answer. So the contrast word is a therefore. Therefore, the patients in ICU should undergo spinal evaluation by CT imaging and interpretations by a consultant radiologist within 24 hours of injury. So the evaluation is a synonym of the rule out. So the answer option A is the correct. The question number 6. What does this update tell medical professionals about bovine insulin? The keyword is an update and about bovine insulin. The answer option, it is being withdrawn due to the risk associated with the long-term use. The keyword is a long-term use. Option B, users may experience difficulties when switching to alternatives. So the keyword is may experience and switching to alternatives. Option C, any side effects are more difficult to identify in the older patients. Any side effects and the older patients are the keywords. So this is a memo to all staff regarding withdrawal of bovine insulin. The bovine insulin preparations will shortly be withdrawn due to limited availability of the active ingredient. People with insulin-treated diabetes who currently use bovine insulin preparations will continue to require insulin treatment. They will need to be changed to alternative acceptable preparations. People using bovine insulins are likely to be older patients with long-standing diabetes. They may therefore have absolute insulin deficiency. These individuals will be at risk of impaired awareness of hypoglycemia, predisposing them to severe hypoglycemia. Use of bovine insulin has been associated with the presence of insulin autoantibodies, which may impair the action of insulin. Porcine, human, or analog insulin are likely to lower the glucose more than the same dose of bovine insulin, and the insulin dose titration may be difficult and unpredictable. People with bovine insulin treated diabetes are therefore a high risk group. Option A, it is being withdrawn due to the risk of associated with the long-term use. The topic sentence saying bovine insulin preparations will shortly be withdrawn due to limited availability of the active ingredients. The topic sentence says the limited availability of the active ingredients. The option A is saying about the long-term use. So the option A is then immediately eliminated. So the option C, any side effects are more difficult to identify in older patients. In the paragraph, second paragraph, people using bovine insulins are likely to be older patients with a long-standing diabetes. The text says there is no side effects are present in the presenter. So the option B is eliminated. And the correct option is a B option. Users may experience difficulties with the switching to alternatives. So in the first paragraph, last line, people with the insulin-treated diabetes who currently use bovine insulin preparations will continue to require insulin treatment. They will need to be changed to alternatives acceptable preparations. Changed to alternatives is a synonymous of switching to alternatives. So option B is the correct answer. Thank you.